should be there should be an icon that pops up on your screen. I would just say that, as always, we ask you to be mindful of sharing PHI, which is protected health information, or PII, personally identifying information. Being aware of that choice. And please do not refer to people in ways that will give information about them that you don't want posted on the internet, because this recording does go on our website. We are going to be using, as always, the speaker queue, which will be myself, possibly someone else in my absence, who will, when it comes time to take questions and comments, I will ask first for names, and you can give me your name for the speaker's queue by raising your hand, and you can do that by clicking the reactions button, and then it'll pop up a place for you to click a hand to raise your hand. You can also use that to lower your hand if you change your mind. And I will be asking at times for people who are on the phone only to give me their names to be entered into the queue as well. And I just want to say, mindful that we have many issues that we talk about. The participant-directed programs are an important aspect of our system of benefits and services through Colorado Medicaid, and there are strong feelings. And so just be mindful of acting professionally and being respectful of others, and being aware of the impact that someone has background noise, the impact that your words and your emotions may have on other people. So thank you for keeping that in mind. We are recording. I will now ask for people who are on the phone only to give me your name.
Ron Heller and Tracy Heller.
Thank you, Ron and Tracy. Have you down? Go ahead.
Yes. Dolores Hurley.
Thank you, Dolores.
Renee
Anyone else?
Farmer.
Renee Farmer, thank you.
Jamie Bartolotta.
I'm sorry, can you say your name again?
Jamie Bartolotta.
Jamie Bartolotta. Thank you very much, Jamie. Anyone else? Okay. So I will move us to the review of agreements. And if I could ask Danny to just scroll down to page 2. I'm not going to go over all of these, but again, I referred before to behavior in the meeting, and sometimes people call it rules of engagement. I really prefer, and we prefer here, to call it agreements, that we're just agreeing on a certain level of how we treat each other, even when emotions run high, even when issues are strong. And if there are moments when I feel that is not working, I'm going to stop the action with respect. So the speakers queue, the other piece about it, thanks, Danny, if you can scroll back up. The other piece is, if you raise your hand, you get to make one question, one comment, or ask one question. Because we have a large meeting, 61 people, we want to hear from as many people as we can. As the meeting progresses, I may be calling on people, even though they're out of the queue line, so to speak, the order that we haven't heard from, because we want to hear from as many different people as we can. And I'm going to limit folks to 2 minutes. And at 1 minute and 45 seconds, I will politely as possible call time, give you a reminder that you have 15 seconds left. So people, there's no easy or unawkward way to do that. So bear with me as I do that, and know that I'm doing it with respect. And apologies for any ruffled feathers along those lines. Is there anyone else who is only on the phone? And if someone on the team can pop into the chat the online attendance link, that would be, maybe you already did, and if so, I apologize. Maybe it's there, never mind. So I will move us forward now. It is 1:08, and I will do a speaker's queue sort of thing for the open forum. And as a reminder, we have 2 of these each month. We've had them in our meetings for years. They are 10 minutes each. I keep time on that. I will take names for people who have items for the open forum, and these are items that are announcements, that are communications in this community. And by the way, we're not pinning the whole responsibility on this open forum for Julie Riskin. Apologies, Julie, we got your name in there on the right. This should be all, and it is indeed everyone. So let me ask if anyone has an item for the open forum. I will look for your name in the chat. And if you are on the phone only, you can unmute and give me your name to be in open forum number 1. Okay, we have a hand raised. Danny, we'll get to you. Anyone else?
It looks like there's a couple in the chat.
Oh, there are. Okay,
Robin and Rita, I can't tell if you're wanting to be in the queue for open forum or just telling us that you're here.
Okay. Well, let's start with, since Rita is not with the department as the first up, we'll get to her and then go to Robin and then Danny to you. Rita, go ahead, please. Or were you just identifying yourself? Rita Noland? Okay, we'll come back. Robin Baldock, please go ahead. Thank you. You have 2 minutes.
I'm having computer problems. Yeah, I just wanted to ask John. I thought Julie had sent you a document that we had asked to be submitted. Consumer direction is actually an international issue now, and the NCAPS folks we've been talking at this point, looking at least one day, an international perspective. And I thought what was amazing is they developed international standards for consumer direction. And I thought Julie had asked that the document with those standards be distributed, and it doesn't look like it has. And I know you have a lot to do, but if you could distribute those international standards, they were absolutely excellent, and they were developed from people all over the world. And I think it's a really good document to look at. What is our program doing? Where do we, where do we fit when we look at those standards? Are we meeting the max as far as consumer direction? The good news is I think we're so far ahead. I have friends in Canada using consumer direction. We are so far ahead of certainly folks in the United States and folks in Canada. And, we can improve what we're doing. So I'd really like to maybe even put that on the agenda next month to look at those standards and have a small discussion about where is it that we stand based on these international standards. Thank you.
Thank you, Robin. Perfect timing. You had 15 seconds, but I do want to respond to you since you brought that up. I did receive an email from Julie in between the meetings. There was a document that looked to not really have it wasn't clear in the document where it was from. So I passed that along to team members to sort out with Julie, I assume. So I'm very aware of getting that email, and we were just trying to make sure that went off properly. And I can't speak to the rest of that except good intentions on our part.
Sounds perfectly reasonable.
I will move us forward. Rita Noland, not sure if you wanted to get into the queue for the open forum number 1.
John, she mentioned that she doesn't have a mic in the chat room.
Oh, okay. Thank you, Kurt. I'm sorry. If there's something you did want to say, you certainly could type it into the chat and we would read it out, Rita. Thanks, Kurt. Danny, you're up next. Danny Comstock.
Thanks, John. I just wanted to take a moment and introduce a new member of our team. We have Sarah Quillen here. She's an intern, a master's social work student intern, and she is interning on the Participant Directed Programs Unit team for the remainder of the school year. So we anticipate having Sarah here with us through the end of June. So just wanted to introduce her, let y'all know who she is when you start seeing her face and her name pop up more. Sarah, would you mind just putting your camera on and going off mute just so people can say hi to you, or you can say hi?
Sure thing. Hello, everyone. It's so good to be here. As Danny said, I am getting my master's degree in social work. I am very eager to learn about everything that goes into this work, and I'm ready to learn from the community and from this fantastic group of individuals. And thank you for the opportunity.
Thank you, Sarah. And y'all will be seeing a lot more of her over the coming months.
All right, thank you, Danny, and welcome, Sarah. I want to just check in again to see if there's anyone else. We do have a few minutes left for this open forum number 1. Is there anyone who has an item? And if so, you can raise your hand in the webinar reactions button, or just the raise hand button if you have a larger screen. Or if you're on the phone only, you can unmute right now and give me your name to get into the queue. Okay. I did want to mention just briefly, as long as it came up, that Rita before had said something in the chat and I missed it. I'm working with a small screen today, folks. I'm in transit, so if I miss something, that's why. That's all. Not trying to avoid anyone here. Want to include everyone. So I'll move us forward. We're early, but expanding self-direction follow-up. And I believe Corina with the department is going to tee this up for us.
I am. Thanks, John. Appreciate it. Hello,
Yes.
everyone. My name is Karina Barrick. My pronouns are she, her, and I'm with the Benefits and Services Division of the department. Here to talk on the participant-directed evaluation study. And we have some slides that we want to share with you today. Are we able to get those presented?
Yes, I'm over now.
So as we're getting those up, if you attended last month's meeting, you heard Julian Chanda speak on the history and advocacy behind this project. Thanks, Danny. This project, as an evaluation, is intended to answer what is the best self-direction authority for specific services. This is not a project to implement, and it will not include regulatory changes. And today we'll just share with you project overview, timelines, and how to get involved. Next slide, please. So we want to identify viable self-direction options for the following services: home modification, non-medical transportation and respite, acupuncture, chiropractic, and massage under the complementary and integrative health waiver. Why these specific services? So these services were identified through feedback from stakeholders specifically. And we've currently identified self-direction authorities we can potentially administer in Colorado. The following authorities are moving these services to Community First Choice, CFC, or amending waivers that currently offer these services to allow for self-direction, or adopting a 1915J or 1915I state plan option. So during the process of this project, each of these authorities will be evaluated to determine their viability and impact if implemented. So both for members and then the administrative impact. And this will leave us with a better understanding of the ideal self-direction option. And for the next few slides, I'd like to introduce Kathy McCoy, who is a senior analyst with Mission Analytics, who is our partner for this project. She'll be leading stakeholder engagement for this project as well. So Kathy, over to you.
Great, thanks, Karina. Hi, everybody. I'm Kathy from mission and how mission is going to accomplish this. Next slide, please. Is like Karina was saying, we're going to go through stakeholder engagement, talk to everyone who wants to be heard. We're going to do a process analysis and assessment summary and cost modeling. We're also going to do Center for Medicare and Medicaid Services concept paper, and we're going to provide a recommendation report. Next slide, please. Okay. So the stakeholder engagement part is going to have a few parts to it. First, we're going to develop a work group collaborative, and this is going to include all the interested parties based on the HCPF interest survey form. We're going to meet with the work group collaborative, including ongoing quarterly engagement. We're going to complete individual interviews and surveys with focus groups of providers, FMS agencies, members, and others as identified. And we're going to share that feedback with the PDPPC collaborative as needed. Next slide, please. So the process analysis and assessment summary and cost modeling, the way that's going to work is first we're going to compile and review state and federal regulations regarding self-direction. We're going to map out services definitions, regulations, and laws. We're going to gather available service utilization and provider network data for all relevant services. And then we're going to explore other state models of self-directed services. We're going to move on to model update and cost of enabling self-direction in different models. And then we're going to provide a summary report. Next slide, please. The CMS concept paper is going to be a brief review of Colorado's existing HCBS systems, including opportunities for self-direction. We're going to give a summary of why HCPF and stakeholders in Colorado wish to enable self-direction for CIH and MRT services, an explanation of how enabling self-direction fits into other HCBS systems change efforts currently underway. And we're going to sketch HCPF's proposals for enabling direction of CIH and MRT services and give a summary of stakeholder input to date. Next slide. Thanks. And then provide a recommendation report. And this will include a 5-page executive summary of the full report, summaries of the information gathered from the policy analysis and stakeholder feedback, descriptions of federal and state statutes, rules, and/or regulation changes needed to implement the recommendations, a detailed cost analysis and estimated budgets for recommendations, an estimated timeline to implement recommendations, any CMS engagement and feedback, and proposed models of self-direction for CIH, non-medical transportation, respite, and home modification services. Next slide, please. Thanks. So the timeline for this work is for the stakeholder engagement and summary of activities. It's from September this month through August of 2024. For the process analysis and assessment summary and cost modeling, it starts in September and it goes through May of 2024. For the CMS concept paper, it's going to be in July of 2024 that we're going to do that work. And the recommendation report, we'll have that ready by September of 2024. Next slide, please. Okay, so what's next is the interest form. I believe, Karina, that's already been shared. And that interest form is open until October 16th. And if you want to contact anyone around that information, contact Karina. Okay, that's what I got. Thanks, Karina. Back to you.
Catherine, this is John Barry. Catherine, we've had a question in the chat
Mhm.
We try to be very careful about acronyms here. If you can say for people, especially those on the phone, what is CIH and what is MRT?
CIH and what was the other one?
MRT.
An MRT. Let's start with MRT first. Well, let's start with
Okay.
the first. Let's start with CIH. That's the chiropractic and massage, complementary medicine, and also acupuncture waiver. And for the other ones, the MRT is home modifications, respite, and non-medical transportation.
Can you, what does the MRT stand for itself, Catherine?
Home modification, so the M for home modification,
Okay,
R for respite, and the T is for non-medical transportation.
oh, okay, very good.
Mhm.
Thanks for that.
Sure.
And I
Good.
will drop a, sorry, John, I just wanted
No.
to make sure I will drop a link to that interest form. I just want to also say thank you to those who've already filled it out. Please ask questions to me directly. The interest form does have an option to capture that as well, but I will be getting all responses back on that week of 10/16. So contacting me directly is quicker. So I will get that link and paste it in the chat in just a moment.
Thank you, both of you. So folks, this is John Barry. Do we have any comments or questions for either Karina or Catherine? If you do, you can raise your hand in the webinar. If you're on the phone only, you can unmute your phone and give me your name right now to be in the queue. Anyone on the phone who has a question? Okay, looks like we have one in the chat. Robin, please go ahead. You have 2 minutes. Thank you.
As always. Yeah, I just wondered, and I can't remember which person it was there. What is, and I'm sure, HICPUF has done their due diligence, but we need to do our due diligence. So can you give me a little bit of background on the contractor that's doing all of this work? Have you done it before in other states around expanding consumer direction, and kind of what has been your role in consumer direction, under other contracts? The concern really is understanding consumer direction in Colorado and how it works. Which is different than other states in that we have full control of the budget. Budget is set, people then have control over who comes in their house, what they're paid, how the work is done. And I think that's the model we want to continue. We want it to continue into these other services. So I guess that's my question.
Thank you, Robin. So I believe Robin was looking for a response, Karina. I'm not sure if now is the moment, but.
John, this is Cassandra.
Oh, hi, Cassandra.
Excuse me, Catherine, I don't know if you can speak on behalf of Mission to talk a little bit about what your history is. I think, we received a couple of proposals on this work. We felt that the work proposed by Mission seemed to really fit the needs of what we were looking for in terms of their experience, their what they plan to do, how they planned to engage with stakeholders. We also had a couple of key stakeholders review the proposals and help us decide what was kind of the best direction to go. And so that's kind of how we got to selecting the vendor that we did.
Thank you, Cassandra. You did start by asking if Catherine had anything further to say about that. I'm just
Yeah, it didn't really answer my question. The question is, what is the background this entity has with providing these types of reports in consumer-directed model of care?
Okay, in terms of missions experience, we've had
Correct.
several years of self-determination work. And so we do understand what this entails.
It's self-determination and consumer direction are two different things. They're not the same.
Yes.
And
we've
it's
had-
concerning that you used a different word that has a different meaning to describe consumer direction.
Right, yeah, self-determination is definitely a different term, but I think that it all encompasses the participant-directed services. We've had a lot of experience in that area.
John, if I may as
Okay,
well, I
yes.
think we want to make clear that we are looking at how can we adopt a consumer directed approach to these services. This is not an expansion of CDASS. It may not look exactly like CDASS or how we authorize that service and how it is done. We are trying to understand if we can and what would be the best way to implement a consumer directed model of these services. And so we felt that their experience in looking at working with self-determination and other consumer-directed services with other states was appropriate and fit the needs of what we were looking to do. So that is how we selected them, because we are not looking to just copy CDASS. We are looking at consumer direction as a whole, and that there are many ways in which consumer direction can be done. And we want to figure out what is the best way for these services, because it is very different to have self-direction for transportation or home modification than it is for personal care services. So again, trying to figure out what is the best way to implement a consumer directed model, not copying and pasting CDASS for these type of services.
Thanks, Cassandra. It looks like we have a couple of other hands that have gone up. I'm looking at our agenda and our time, trying to assess whether we move forward. Let's see. Chanda, you have your hand raised. You have 2 minutes, thanks.
Yeah, I just wanted to add to what Cassie said too. One of the things that I found is that there's other resources that Mission Analytics will be tapping into in terms of a lot of FMS or providers that have been in that world. And so they're also going to be tapped into various other sources just other than their own experience in that area. So I just wanted to kind of share that additional component to, experience and knowing that there's other people to kind of be there along their side and support them.
Thank you, Chanda. This is John. I will move us forward at this point. We are now moving to community first choice. And let's see, usually it's Christine. Are you with us today, Christine?
Hi, John. Yes, I'm here.
All right.
Hi, everyone. Christine DeSantis with the department. This past month, the CFC team has been working on finalizing our draft state plan amendment, or SPA, document for CFC in preparation to share that with our stakeholders and the council members in the coming month. Our next council meeting is in October 4th at 10 a.m. And at that meeting, we will be reviewing the basics of what a SPA is and preparing the council members for how to provide the department some feedback on that SPA document once it is posted. And that is all I have. Very quick today, unless anyone has any questions.
This is John. Folks, if you do, you can raise your hand in the webinar to get yourself into the queue. Or again, if you're on the phone only, you can unmute your phone right now. By the way, that's *6 to unmute your phone or to mute it afterward. Yep. I beg your pardon. Had some background noise myself. Okay, Kurt Wolf, you have your hand up. You have 2 minutes, sir. Thank you. Looks like Kurt might have lowered his.
There we go. No, real quickly, maybe I missed it. What is a SPA acronym?
It's a state plan amendment. I think I said it, but that's okay.
Okay, and I might have missed it.
That's okay. So it's an amendment to our state plan, and it's the official document that we have to submit to the Centers of Medicaid and Medicare to get our CFC program approved.
Okay, thank you.
Mm-hmm.
Thanks, Kurt. Any other questions or comments for Christine?
Okay, so what do you got?
So
it's wired right. I'm sorry, Kurt. Let me. Okay, sorry about that. Anyone else, folks? I don't see anyone. I just want to mention and give a plug for every month. We do have another monthly meeting, which is a really important meeting, the Community First Choice Council. It is on our online calendar, just like the PDPPC is. And they do, actually, there is a Community First Choice newsletter, which goes out monthly. And you can find that information on our website. If you are having a hard time finding any of that, email me, John Barry. I left my email up at the top of the chat. I'd be glad to share with you how to get to those places to sign up for the newsletter, to find out, get the meeting information. So again, thank you, Christine. We are about 10 minutes ahead of schedule. My guess is we'll need it. Jessica, you're up next. Request for proposal.
Hi, John. Thank you. Hi, everyone. Jessica here. I'm going to provide a few important updates that we have about the FMS and training and support requests for proposals. So I'll use RFPs as the acronym moving forward for that. I also want to just note before I get into it, anything that I reference that can be linked in the chat will be, and I'll also provide our contact information, both email and phone, at the end of my update. Some items we are planning to send out to stakeholders through John's PDPPC listserv, so you'll want to keep an eye out for those. So both RFPs have been posted to the Colorado Vendor Service Self-Service website, it's called VSS. This is where interested companies submit proposals for state RFPs, as well as the general public can review the RFP information and all of the documents that were contained. We announced this posting of the RFPs to stakeholders through an informational memo. Again, that will be put in the chat, as well as through John's Office of Community Living newsletter that he just mentioned. And then, of course, right now, today. The memo specifically has instructions for the general public to follow if they want to look at those RFP documents. They're pretty simply laid out. Additionally, we have a fairly comprehensive document that was requested by a few stakeholders. This document provides essentially a summary of stakeholder feedback about our contractor services, as well as a crosswalk for how that feedback was incorporated into the RFPs. That document is still being reviewed, but it'll soon be available to any stakeholder who would like to receive it. Again, it's fairly comprehensive to meet the request that we received, but a second document that is much simpler and more aligned with plain language standards is nearly ready to send out through John's avenues, but it was included in the RFP, FMS RFP documents. So that is accessible, again, through the public access. Instructions on how to do that are in the memo. I'm also happy to send that simpler, it's the Appendix F document out as requested by individuals. RFP proposal deadline is currently 3 p.m. on October 25th. I do believe that's a Wednesday. As well as I mentioned last month that we will be moving on after the proposal period to evaluations. However many we get will be looked over by an evaluation committee, and HCPF policy really focuses on ensuring that that committee doesn't have any element of bias for or against any of the offers that submit proposals. And so it will be HCPF staff on those committees, and they've been fully vetted in terms of the process and the expectations. That's a process that procurement leads and is very diligent about. And really, I just want to end with, we are excited that we've come to this point. It's a long process, and I know you guys might agree with that. We still have a ways to go, and so our goal is to have this be as successful as possible, resulting in great contractors being selected for the term starting July 1st of next year, so that they can provide the best service to CDASS and IHSS members, participants. That is all I have for now. I'm happy to take questions. Please know that because this is a pretty formal process, some questions may not be able to be answered, but we do have a representative from Contracts and Procurement here that can help, as well as others in OCO.
Thanks, Jessica. Folks, given that constraint, if there's any comments or questions, you can raise your hand in the webinar. You can unmute your phone. If you're on phone only, *6 to give me your name to be in the queue. Looking for hands raised in the webinar. Hearing no one unmuting their phone, giving me their name. One more time. Okay. Looks like we have none for now, Jessica. Thank you.
Okay, I did realize, I'm sorry, it just came to my brain, John. I didn't give contact information. So let me do that.
Okay.
So I hear.
Go ahead. We had some background noise. I'm sorry, I stopped it. Go ahead, Jessica.
That's okay. So you can email for the documents that I've mentioned, or if questions come to anyone later, comments, you can email our unit at HCPF, HCPF_PDP for participant directed programs at state.co.us. You can reach us by phone at 303-866-5638. Thanks.
Okay, thank you. Kurt Wolf, did you have a comment or question, sir?
No, John, I was just getting prepared for the overspending protocol. My apologies.
Oh, okay, we'll get with you. Thank you. So, one more time, any other questions, comments? Doesn't sound like it. Okay. Kurt, we'll turn it to you, overspending protocol. Do you think if you could have, sounds like a TV in the background, if that could be muted, that would help? Kurt Wolf?
Sorry, why don't we pass for right now? My son is here working with me as well, and he's in the other room. So I didn't think you'd pick it up. For right now, yeah, if we could just put that off, we can bring it back around in a few minutes. That'd be great.
I'll see if we can switch items. Thanks, Kurt. So, team, we have a question, and I know we're first of all running very early to begin with. This is how we sort meetings out in real time, folks, during the meeting, so bear with us here. Might it be possible, team members, to have the eligibility discussion item go at this point?
Hey, John. Because we've had to call in other departments to do this presentation,
Yes.
they're planning on being here right at 2.
2 o'clock.
So
Okay.
I don't think, I'm looking to see if everyone is here, but I don't think they are. Yeah, doesn't look like it.
Okay, well, in that case, I will move to impromptu, ask Emily Harvey to join the meeting and speak about stakeholder engagement opportunity, if you would. Thanks, Emily, for that offer.
Of course. All right. Hey, folks, my name is Emily Harvey, and I oversee the in-home support services, service delivery option, along with homemaker and personal care and all that fun stuff. And I am working with my cohort here, Danny, to be able to provide an opportunity for stakeholders to join in. We've got 2 stakeholder engagements for the exact same purpose, and that is reviewing the protective oversight and accompaniment documentation guide. It's a supplement to the current health maintenance activities, or HMA, documentation guide that's available for folks. We did provide this, or we did develop this supplemented document in order to kind of address some of the bigger questions that stakeholders had, case managers, IHSS agencies, members, ARs, advocacy groups, wanting to know more information or get additional guidance on protective oversight and accompaniment. And so those 2 tasks, we are exploring additional guidance. So we are looking for participation from you all to be able to review this document. We will provide it ahead of time based on people reaching out and providing their information and their interest. And so we'll put information in the chat of the PDP inbox, so you can let us know if you're interested in participating. I do want to provide you with the information. I will put in the chat the dates that are available. And essentially, again, I want to be clear that we're not looking to make any policy changes. What we're looking for is, with the current policy, how can we expand on the explanation and provide additional guidance? So we're not looking to open up any additional changes. We're not looking to add any services or anything like that. We're strictly looking at it as is, and then finding an opportunity to be able to provide that clarification that is so needed. So we are offering this here. Let me just open up my my handy dandy note here. Apologies. All right. Thanks for your patience as I pull that up. So we are looking for stakeholder engagement on Tuesday, October 17th. We're doing an evening opportunity from 4 to 5. And we also have a second opportunity, which is going to be Thursday, October 26th. And that's going to be a morning meeting from 10 to 11. This information, again, will be put into the chat. We are looking for participants to express their interest via our inbox, that HICPUF PDP inbox, which we'll put into the chat as well. But we are really interested in soliciting your feedback, because we know that this is a very needed resource, and we want to do it well. We want to do it right, and we want to make sure that the right people are at the table. So if you are interested, please, you can email the HICPUF PDP email address, which is hcpf_pdp@state.co.us. I will also, I'm realizing I don't have the PDP phone number available in my head right now, so we can find that and put it in the chat as well. I just want you to be able to have the opportunity to express your interest in this really important stakeholder opportunity here for us. So if you are interested, you can either put it in the chat, you can email us. We want to be able to open this up to folks, which is why we're having two separate meetings. These are going to be the exact same meetings. So if you can't make both, that's fine. Pick one and join us for that discussion. But thanks, that's what I've got here, and I appreciate and look forward to working with you all on finalizing this document.
Thank you, Emily. Looks like the email address and the phone number have been put into the chat. So folks, for those who are on the phone only, the phone number to reach the participant-directed programs team is 303-866-5638. Again, 303-866-5638. Okay, thank you. And let's see. Bear with me here. We are at 1:48. And we have the next item scheduled for 2 o'clock. So I think that what I'm going to do here is to have us get a brief break. Let us come back at about 5 minutes to 2. And we will get the item started at 2 o'clock, and then we'll have our other break. But I think rather than have people sit here being a little respectful of people's time, we will take a timeout. It's now 1:48 on my clock, and we will come back at 1:55. Okay, we'll see you in a few minutes, everybody. Hello, folks. This is John Barry back again. It's 1:55. And before we move forward, looks like Emily, you are in the meeting still at this point. There was a question about those meetings you mentioned, stakeholder meetings, whether you have links for them. Will those be sent out or available to people on our email list or register in advance?
I'm just typing something out so I can verbally. So the links to the meeting will go out with the document to review ahead of time, along with the agenda, and that is going to be coming out when we get a better idea of who would like to be involved. So specifically Michelle, we'll make sure that you're added to the invite list. Other folks, please feel free to, like Michelle did, put it in the chat, or if you'd like to email us. Oh, sounds like I'm cutting in and out. Were you able to hear that part? Essentially, the meeting information will be sent out in a couple of weeks. And if you would like to participate in this opportunity, please either put it in the chat or email us directly. I hope that came across effectively.
Yes, thank you. A little bit of cutting, but I think it was clear. Thank you. So I will, a few minutes early, turn over the next item to be teed up, I guess, eligibility discussion. And I'm trying to recall who was going to tee that up for us. Was that you, Emily, or Danny, yourself?
Hey, John, this is Danny. I'm just looking to see if the folks who are presenting this are in the meeting.
Got
I
it.
know we had Natalie and Maribel, and I'm looking to see if either are here. Yep, it looks like I don't see either one in the chat yet. Let me just ping them.
Okay. I see a name, Natalie Twist. Is that the person you're looking for, Danny?
No,
Okay.
no, her last name's C. She's with
Got
HIPAA.
Got it. Well, folks, while she's doing that, I just want to explain our little mini dilemma here, which is, oh my gosh, it's been a year more. I don't know. Someone will know. Jessica may know. We've had the breakout rooms, a great addition to our meetings. What we do is really try to have them be around the same time each meeting, which is a constraint because otherwise formerly we could move all sorts of things around and keep moving. But there are stakeholders who we know call in or click into the meetings specifically for the breakout rooms. So we don't want to preempt that by moving the time around so that when they come, the breakout rooms have already happened. And we have had a little error in the agendas the past few months, and I apologize for that. That's my fault. They are actually 25 minutes in length. So when we get to it, instead of it being till 2:55, no, that is correct. I guess on the original agenda that we sent out through the email, I know it was 3:05. So these are going to be 25 minutes in length. So I do apologize for that error that we had. What you see on the screen certainly is not what came to you through the email. And we do have a break that we adhere to and have it be 10 minutes. The other constraint is we do have the 2 open forums that are 10 minutes each. Let me check in and see while we're waiting. Is there anyone who is on the phone only who has not yet given me your name for attendance purposes? Okay. I wonder if while we're waiting, we could do Kurt's item. Kurt Wolf, I see your hand raised.
Yes, I got time to talk about that now. My apologies to everyone. I have contractors in and out today, and it just gave me a window, and unfortunately it happens to be right now. So real briefly regarding the overspending protocol, I did submit a proposal to the department regarding the 130% limitation on a monthly allocation amount. There was a very compelling discussion about this in a meeting I was not involved in, but I was able to email, I believe her name is Christy, back and forth regarding the justification from that. And that did get submitted about 2 weeks ago. So I'm not sure if anyone is on this call that can maybe give us an update from the department. But basically it was saying that in certain circumstances, we would like to not have that be a limit, as there are some people with, especially with larger allocations where they have to save up, especially for items like traveling or even just special needs, when those things pop up, where there might be an occasion where they would have to spend more than 130%.
Kurt, let me, Kurt, if I may interject and pause you with apologies. We're going to come back to you. We do have the folks for the eligibility discussion, and they are here for just these 20 minutes. So
okay,
we're going to give you more time later. Whatever you need, we'll do it.
Sure.
But thank you, sir. Okay, Danny.
Thank you. Alrighty. So I believe, yeah, looks like Natalie and Maribel are both here. Emily, I believe you have the slides, if you don't mind presenting them on the screen, and then I'll go ahead and kick it over to Natalie and Maribel, where they can talk a little bit more about the eligibility processes as it relates to the public health emergency unwind.
Sure. Good afternoon, everyone. Thank you so much for allowing the time for us to join you and talk a little bit about what's going on. So again, my name is Maribel Klukman. I'm the Eligibility Division Director for Healthcare Policy and Financing. And then Natalie somewhere. I'll go ahead and get started, and then she can introduce when she kicks off as well. So next slide, please. So as you all know, we've been working on once the public health emergency ended, we have quite a bit that we're going to restore renewal processes back to normal, and I'll use the air quotes. And so as part of that process, the key thing here from the department is making sure that we're identifying where's the need, who is the most vulnerable, and what can we do to help, and trying to have the best member experience as much as possible. Which has led to some of the things that we're going to talk about here. In addition, we have some federal guidance that we've received that we're also working through. So lots of activity going on. So you may or may not have heard, let's start with that federal guidance. There was some guidance from CMS about ex parte. And again, ex parte is our first step in the renewal process, where we try to see, it's a tool to see, can we make someone eligible and not have to go through the whole renewal process? So the guidance that they sent to us is that at that first step, that ex parte, is if we have children that may potentially be eligible, but yet other members in the household are not. In today's world, what we and many other states do is we send out the renewal packet to the entire household. And then what happens if they don't send the renewal packet back to us, and they get discontinued for failure to return the renewal packet. With the guidance from CMS, they say we should be approving those children and not sending out renewal packet. And the packet goes out only to those other individuals. So based on that, we're moving fast and furious to be in compliance. Again, most importantly, understanding that there's members that should be approved that haven't been. We want to make sure and get them to get taken care of. So this is a positive effect to the member. As of October, we're going to implement a short-term fix or a mitigation strategy, where we're still going to continue to send out the renewal packet, but then before terminating, we will have identified those primarily children and approved them, and then other members that did not send back the renewal packet may get terminated. Now, if a family sends back the renewal packet, they don't fall into any of this, because then we go back to individual determinations at that point. So we have a short-term fix that's happening in mid-October. The other part of the guidance is that we have to go back retroactively to when we started our COVID online and identify members that we've already closed and reopen them. So that's something that we're also working on right now, and more information to come as we work through that. So in the meantime, we paused terminations for September renewals and October renewals to allow us to implement that October fix. So, we paused as far as or extended the not allowing a termination to occur for packet not being sent back. So we actually leveraged the same functionality that we did for long-term care members. So that second major bullet on this slide, again, as part of our analysis and assignment and feedback from you all as well, we deployed a strategy to really protect our most vulnerable, so our long-term care members, PACE, buy-in members. So as of September and going forward, we're allowing an additional 60-day extension to get that renewal packet in. So this is specifically for members that either A, the renewal packet has not been sent back in, or B, maybe it was sent back in, but it's not entered by the county or the eligibility worker. So we're providing the 60-day extension, and we're doing some outreach to connect with these members and see what's going on. Like, did they not know the renewal packet was needed? Did they not receive it? Are they saying that they sent it back and X county or site may not have heard back from them? So some significant effort and work there to again protect these members and try to give them an opportunity, because we know that majority of them are still eligible, and so we hate for them to be terminated because of an administrative procedural reason such as not sending back the renewal packet. So both of these started as of September 5th. The long-term care continues through June 2024. And then the other thing too is if we have any verifications, that doesn't fall into this, but eligibility workers have the opportunity to provide a good faith extension, which gives members an opportunity to have more time to send verifications if needed. I just laid out quite a bit, so I'll pause there for a minute on questions on this. I thought I saw a hand up somewhere. And maybe I should keep going just because we only have 20 minutes. So how about we hold up on questions a little bit? So sorry about that. Let me go to the next slide. So then the other thing is, as I mentioned, we're trying to figure out and continue to implement best strategies for taking care of our members to the best of our capacity and with resource limitations. So I just want to call out that CMS had provided a list of strategies and flexibilities that states could implement. And they sent this out in June of 2023, which doesn't give very much time for anything that has system updates and timeframes. We have, because we're doing so many other things, we have limited capacity. And right now, they're temporary flexibilities until April 2024. So by the time we get them up and running, we wouldn't have really time to really make them beneficial. We're exploring a couple of those flexibilities. One of them is the at or below 100% FPL that we're still looking at. But still looking forward. So the next slide, please. What I do want to say and reassure everyone is that although we might not be taking all the flexibilities from a CMS perspective, we do have some flexibilities that we've implemented ourselves. So, we implemented the zero income, which says if someone reports zero income and we verify there's no income, we're able to just move forward without additional verification. We have streamlining some income determinations. We've delayed premiums for our members. Next slide, please. We've also worked on some other strategies that I just talked about. So the long-term care extension is actually one of the strategies. So we're working on that. We've had some, technology, intelligent character recognition, ICR, to help with renewals. We're reformatting the renewal packet, and then enhancements to streamline the whereabouts unknown. So just want to reassure everyone that just because we're not taking all the strategies from CMS doesn't mean that we're not doing anything. And that's part of the reason why we're not taking more, because of the work and effort that we're already putting into this. So with that, I know, Robin, I apologize. I see your hand up. Let me hand it over to Natalie first for the next slide, and then we'll get into questions.
And I only have 2 slides, so we'll get to your questions very quickly. And from a communications perspective, what we're doing really just builds on the work that Maribel's team has done. So we've added language in peak about the reconsideration period so that when someone passes their renewal deadline, but they're still within that reconsideration period where they could turn the renewal in late, and avoid a gap or avoid starting a new application, they'll get a reminder in peak. So that's an important new thing that we've added in response to asks for that. We're doing additional outreach from the MCC for our long-term care population. So again, long-term care folks who are receiving an additional 60 days to complete their renewal, not only are they getting more time to do that, because we know that those cases are more complex, but we'll also be reaching out to them proactively. And we're equipping our member contact center with a script to do that work. And then at RAISE are doing additional follow-up in September and this early part of October for folks who are potentially impacted by the brief extension due to us implementing that short-term fix for the ex parte change. Again, there's no change to the member experience. They're not going to feel or experience anything differently. But in good faith, we wanted to reach out to folks and have an additional touch to them to remind them about their renewal, and they have to take action in order for us to determine eligibility. And then we're still looking at additional outreach during the reconsideration period. We're hearing and talking to groups like you all to hear what's working on the ground, what we can implement sooner, because we know we're already a few months into unwind. So it's lovely to talk about things a year from now, but we really want to focus our energy on high impact things that are happening right now. And we have some trans-created toolkits that are almost ready. These are all of the communication materials that we had created in English and in Spanish that are now going to be available in an additional 11 languages, because we've heard that outreach to non-English, non-Spanish speakers is really hard, and it's a huge need. So we want to make sure that we're equipping community partners with scripts and resources to reach people who don't speak English or Spanish. I think next slide, please. Oh, I thought I had 2 slides. Just kidding. I only have 1.
Thank you, Natalie.
Sorry.
I was going to go ahead and ask for questions or comments using our speaker queue. I'm sorry, I was premature.
No, not at all. I was wondering if Maribel mentioned the redesign renewal packet. I might have just not heard that.
I did mention it really quickly. Apologize.
Okay.
So, yeah, that's
we'll be communicating. Yeah, we'll be communicating about that as well. We're really excited about that. It is responsive to a lot of member feedback that we've had on the ground. But we will be getting that message out to members through the member newsletter on our website. And you'll be seeing it in partner facing avenues as well, so that you can also share that with members. And that was my last plug.
Thank you. Sorry for the interruption. Folks, if you have a comment or question for Natalie or Maribel, you can raise your hand in the webinar now. Or if you're on the phone only, you can unmute your phone right now, *6, give me your name. Anyone on the phone? Okay, we have Robin so far. Robin, thank you. Go ahead. You have 2 minutes.
Oh, okay. The question is, as we speak, I'm getting text from someone who's going through a renewal for long-term care and the buy-in. And I had the same experience in that the texts don't seem to understand the different waivers and the rules for each one. Specifically, what I'm hearing on a pretty regular basis is they don't understand how to count spousal income and assets. Even when we are not applying for Medicaid. So that's a pretty consistent mistake that has been a problem, for years. And it's just, a bigger problem now. So folks are being asked for information and scared they're going to lose their eligibility because the information really not relevant. And given the data breach that just happened, the fact that, for instance, all of my financial information is in the Peak website, you've placed me at incredible risk when none of that information was relevant or you shouldn't have access to it. So I didn't know how that was being taken. Thank you so much for protecting people with long-term care and giving an extension. But if the tax, especially all of those hundreds and hundreds of new ones,
Robin, you
don't know
have
the
15
rules,
seconds.
I'm finishing, John. If
I'm
the
sorry.
tax don't know the rules, then we just have a new place for a problem to occur. I'm done.
Take the feedback, Robin. I know we've worked with some of the feedback you provided, some of this as well for us, and so we have extensive training that we've been providing. So I think what's helpful is for us to continue pinpoint where additional training and handholding is needed. But definitely, I know what you're referring to, and trying to figure out how best to continue to streamline that. Thank you for that feedback.
Thank you, and apologies, Robin. No easy way for me to do that. I do apologize. Kayla, you're up next. Thank you. You have 2 minutes.
Hi, I just wanted to clarify. So we have clients that are financially closing, on long-term care, and we were keeping them open for an additional 90 days. But after that slide, it sounds like we're keeping them open for 60 days to try to resolve the issue. Is that correct?
The ones that we're keeping open are those that a renewal packet has not been received. So if the renewal packet has been received and they're pending for something else differently, then that's a different timeline. And then just to make sure, are you referencing the 90-day reconsideration period?
Sorry. So I work for a SEP. So we have people that are on HCBS waiver, and obviously you guys are doing renewals. So if they maybe are missing verifications or whatever it is, I thought we were keeping people open for an additional 90 days to see if they could resolve the issue. And again, I think it was just turning in like bank statements and things like that. So I just wanted to double check if it's 60 days or 90 days, and maybe it's a totally separate person I need to ask, but I just wanted to make sure.
Well, that might be a little bit different, Kayla. So the 60 days is specifically if a renewal packet has not been received or sent back.
Okay, thank you so much. I appreciate it.
You're welcome.
Thanks, Ashley. You're up next. Thank you. You have 2 minutes.
All right, thank you. I was doing my renewal, and I'll spare a lot of details, but when I had put in all my financials and uploaded my bank statements and the bills from the dentist and prescriptions and things like that, I uploaded everything, but I didn't submit incomplete application in the Peak website. Just because I didn't have my son's social security number. And so I'd saved it. And then I went back in a week later to pretty much finish everything that I needed to finish. And everything was gone. And like nothing was ever uploaded. It was kind of like the application had already been taken by Peak. So then come to find out in August that I lost my long-term care, and they had switched me into just a Medicare Part A, Part B, and that I needed to file an appeal. I was just wondering if the Peak website, and I went there many times and it never told me I needed to show financials. And I was just wondering, like, from February to August, how come there was never, I guess, documentations that need to be shown, and it never showed up on the Peak website?
Ashley, that's a really good question. I apologize. Maybe we could get that question and follow up. We can take it back to our Peak team. I honestly am not sure. I'm not savvy enough to know what was going on with Peak and answer your question. So we can definitely take that back for you, please.
Okay, thank you.
Thank you, Ashley. Anyone else have a comment or question? Have another hand raised. Kurt Wolf, thanks. Go ahead. You have 2 minutes.
First of all, I'd like to ditto the last person. Quite frequently, the Peak website's not up to date. Well, I just looked myself for any redetermination. I was wondering if any of that would be on the website to renewal as opposed to sending back a paper packet per se. So that's my number one question. And then also, same thing regarding financials. And even though I'm on the buy-in program, even though I submitted them, They never seem to be ever recognized as uploaded, even though I did several times. So if we could follow up a little bit more information on the Peak website, that'd be appreciated. And again, about the packets, are they going to be mailed out, or are they just something we can fill out on the website?
Right, so Kurt, with regards to your first question, yes, we absolutely are able to do renewals on online as well. So you can do them through the Peak website versus just doing it in a paper packet. And you can also do it on your mobile phone as well as we update our mobile app to be able to do that as well. With regards to your Peak, you and Ashley had questions. So Danny, I think what I would recommend, and I'm saying this out of turn, but I wonder if maybe it'd be helpful to get the Peak team to join this group sometime and maybe have a kind of a little bit of an overview from their perspective as far as Peak and renewals, and then opportunity to ask questions there as well.
Okay, Maribel, that's some good feedback. Yeah, I'll connect with you and see what we can get figured out, because I know that eligibility is a hot topic and it impacts every single member at some point or another. So whenever we can get good information and get them connected with the best people to help, it's good plan. So I'll connect with you to figure out how we can do that.
Thank you, Danny.
And I do have one more comment. This is Kurt again. Quite frequently in the past, although not recently, if things for some reason go from the state to the county, and the county will say all of a sudden you're not eligible, or the state says you're ineligible, the county automatically stops that, and the next thing CDASS stops immediately. And it's not retroactive. So if you don't get that fixed within that pay period, the only one suffers are the attendants who are taking care of us. So it's very important that that eligibility gets moved forward to the correct entities to keep things moving forward.
Yeah, I appreciate the feedback, Kurt, and that's part of the reason why we deployed our strategy as well, to figure out how can we continue to support members, because we understand even one day be very critical for individuals.
Thank you. I believe that we are at time for this item. I understand, Maribel, you and Natalie have the 20 minutes, so I think we've overstepped that a couple. Thank you very much.
Thank you all for the opportunity to join you. Appreciate it.
Thank you.
Take care.
Thanks. We did, Kurt, call a timeout to what you were discussing briefly. We have a few minutes before the break. Is there anything further that you wanted to say about that item? I think it had to do with the proposal. Were you saying you had submitted a written recommendation?
Yes, I had submitted to both you and to Aaron, as a matter of fact, and Aaron acknowledged that it was being forwarded, I think, to Danny for further review. I just want to let everyone know that I did submit that.
Okay. Thanks, Kurt. Well,
30. All right.
Okay, thank you. So now we are at 2:24, which is actually perfect timing in some way to move into having 10 minutes before the breakout room. So folks, I will call time, 2:24, and we will come back at 2:35 and get started with the breakout rooms. Thank you, everyone. See you in 10 minutes. Okay, folks, we are back. This is John Barry. Again, we are recording this session of the PDPPC, the Participant Directed Programs Policy Collaborative. Again, today, September 27, 2023. And we will move now to item number 11 on our agenda. And this will be a 25-minute item once the breakout rooms start. So I will turn things over to Jessica Corral. Thanks, Jessica.
Hi, everyone. I'm opening the rooms now. Again, we've got, you have the option to go down to your menu and select breakout rooms and choose the room you'd like to go in. Alternatively, you might see a pop-up window to choose the room. If you're having any trouble or are calling in, hang back and John can help assign you to the room of your choice.
And this is Jerry. I don't see how to go to a breakout room.
Okay, Jerry, I will help you get there.
Thank you.
Let me see. Okay. Anyone else? This is John. If you want help, need help to get to the room you want to get to, just unmute. Let me know.
Renee,
Renee, I heard you. Your
Dolores.
Renee, your last 4 digits or last 3 digits again, Renee?
762.
Got it.
Thanks.
And Dolores, I heard you. The last 3 digits of your phone number, Dolores?
Yes, that would be 7364.
Got it. Thank you. Anyone else?
I always ask, but I don't see where the little thing is in the dots for the breakout rooms. This is Sandy.
Yeah, hi, Sandy. If you scroll, this is what I'm looking at. Scroll down to your name, it shows up in blue, and then to the right, it says assigned to. Which one do you want to go into? FMS?
Yeah, there's the dot, but I have to ask. Yeah, I don't.
That's okay. That's all right.
Okay, yep, FMS, thank you.
Anyone else? Kurt, I see your name up on the screen. Are you on the call still? Do you want to go into a breakout room?
Yeah, again, I don't see where to get into a breakout room, so
Oh, that's okay. Members only, right? Or
yeah, that'd be fine.
Yes, sir.
Same for
Anyone else?
me. This is
Nathan.
Nathan. Yeah.
They need you. They need you, sir. Okay. Thank you. Anyone else?
Hello? Hello?
Hello. Hello.
Hi, it's Jamie. I'm trying to get into the IHSS. I have my computer up, but it doesn't have the video and the audio, so I'm in the room, but I can't hear anything.
Oh, gosh. You're in the which room, Jamie?
IHSS breakout room.
Okay, I'm looking to see Jamie, and you are muted.
Mm-hmm.
Let me see what I can do. I can't. Can you hear the room?
I can hear them. They can't hear. They wouldn't be able to hear me.
Huh. Okay. Let's see. Are you using your phone or your computer audio?
Oh, I see. They want. There's a new. Well, let's see. Provide bulletin. I'm using my phone to hear, but I can see the room on my
Okay.
on my desktop.
Why don't you? So, are you using your phone to also speak? Right now, you're using your phone. Is that correct?
To hear, yes.
To hear,
Yes.
and to speak into.
Yes, sir. Yes.
Okay, why don't you press *6 on your phone? See what happens.
Okay.
Can they hear you now, Jamie? Or can you hear me still?
No, it's muted.
Oh,
Hello?
yes. Can you hear me, Jamie?
Yes, I can hear you.
Okay, but they still cannot hear you. Okay, I'm not
No,
sure.
I can.
Tell you
I
what,
may
Jamie,
not be able to do it that way.
did you enter into the meeting through Zoom? Right?
Yeah.
Okay. May I suggest that you leave the meeting and come back in altogether? Leave the meeting and then come back in. Okay, Jamie, can you do that?
All right. Well, I can hear them. I just might not be able to participate. They don't
Well,
have.
if you just leave the webinar
I don't have the.
altogether and then come back in. Can you do that?
Leave the webinar off.
Yeah, the Zoom webinar and then come back in.
How would I connect my phone?
Did you dial in separately on your phone, Jamie?
Yeah, I did.
Oh,
It's okay.
okay.
I'll just listen in.
Okay, I'm so sorry.
I'll just listen in.
All right.
It's all right. Thank you.
Yes.
Bye-bye.
Is there anyone else who would like to get into one of the breakout rooms who's having trouble or would like help otherwise? Okay. Hmm.
Is the screen okay, Jessica, that you can see, or Danny? Great, thank you.
Hello, everyone. This is John Barry again. Let me check in with team members. Are the breakout rooms all closed at this point?
I think they are, John.
All right. Thank you. And folks, we are back after the breakout rooms. We are moving back to our agenda and item number 12. And the subcommittee and work group report out. I see a hand raised. It might have been from before. Kurt Wolf, did you raise your hand?
Yes, I did. John, I just happened to notice that it appeared our breakout room was being recorded again. So I'm not sure if it's actually being recorded. I know I talked to Jessica about this once before and said it didn't appear that everything was coming through, but just want to make sure you guys are aware that it's still showing that it's being recorded.
Okay, Kurt, we did look into this before. I think this is a great question. Thanks for bringing it up again, because there's issues here of trust and boundaries. So what we have determined is that Kurt, if you can mute yourself, thank you. That the only persons who can initiate a recording who are not in the breakout room themselves would be like a co-host, a host or co-host, and we have never, anyone in the department on our team have never initiated a recording of the members only breakout room. And so it might be that someone within the room decided to record for themselves, but I don't think they would even be capable of doing that. This is what we've been told through Zoom. I will look into it one more time, sir, because obviously it's an important issue of trust. But we have had never any intention, nor have we made any effort, done anything to click any button to record the members only room. But I will look at it again and get back to you folks. Okay. So the first sub bullet is breakout room report out. And I will turn it over to someone, for example, starting with IHSS. Is this what we're doing here? I'm at a bit of a loss. Emily?
Yeah, absolutely. And I'm happy to start this out. So with our breakout room report out, for IHSS, we do use this as the opportunity for stakeholder engagement with our subcommittee that we switched from every other month to monthly. And within our breakout room today, we discussed a few different things, including member eligibility from more of a provider standpoint. We did provide some information regarding the provider bulletin that just went out today. We also discussed some more topic-specific things about tasks and task definitions, what may be appropriate, what might be duplication. And then we also had some folks share some of their experiences that, they'd like some support on keeping members with their services, especially during transitions from, children's services to adult services, things like that. And so it was a really great discussion to kind of see where folks are at and provide some good resources. And we've got some good follow-up to be able to provide even more resources for folks to do their job with excellence. So it was a successful breakout room once again for this month for IHSS.
Thank you, Emily. So moving along, I guess then the FMS breakout room, any report there?
Yeah, John, this is Jessica. So we didn't get to a lot of topics. Mostly we talked about the most efficient ways to send information, and it was spurred on by a comment made by one of our SEPs. And so the biggest takeaways from that were, unfortunately, fax technology is not super reliable these days. And so our contractors and the department really encourage everybody who needs to transmit data or documents, really avoid faxing if at all possible, as well as we want to highlight again that PPL has changed their email address. The last part is at pplfirst.com. They're still receiving emails through PCGUS, but be aware of that change, and those updated email addresses have been posted in various areas. If you have more questions, please reach out to them. Lastly, I'll just highlight again, it's been mentioned in PDPPC a few times that we are working really hard to totally revamp the Participant-Directed Programs webpage, so it has a lot more information and resources for everybody and can operate a little bit better as a one-stop place for information and things that different stakeholders need to do. So that will hopefully happen very soon. I think that's all I have, John. Thanks.
Thank you, Jessica. And the other room members only, I will just say, and Kurt, you can chime in here, but it's a confidential meeting, so there is no report out intended from that group for the public, the general meeting here. So we'll leave it at that. Is that right, Kurt? I see you're unmuted.
That's correct.
All right,
unless
sir.
Robin or Oliver, Chanda, if you had any input you wanted to add to our meeting that's relevant.
I just want to make a comment real quick. I think where the confusion around is people viewing closed captioning. And when you view closed captioning, it said this transcript is being, closed caption is available. And at the end, it says recording on. And so I think, I think it's got to do with closed captioning, not recording of the actual video, but I think it's got to do with the closed captioning conversation. And so my concern is that closed captioning conversation being recorded? Because it says it's recording on, and it's the closed captioning. It's not video, but it's the closed captioning that I think we're concerned about.
Okay, I can speak to that then, Oliver, and thank you for clarifying that. So I said before that in terms of an audio recording, the only people who can do that are people who are hosts or co-hosts of a meeting. And in the case of these meetings, it's the staff. But it is possible for anyone in a breakout room to request captioning, and it would be sent to their email address, is my understanding. Anyone in a breakout room can do that. So maybe, Kurt, that is what you are seeing, and that is what was reported a month or two ago by Robin or others or whoever it was.
That certainly could be, and I think that's what I saw. One more comment just for everyone out there. I strongly encourage that you join the members only section. This whole intent of our meetings is to have open, free conversation regarding every topic regarding participant directed, the CDASS program, IHSS. And so we can speak freely, and whether it's just to, excuse my French, to bitch and moan about something or not, feel that you're all part of a team and that you can join in. It's a great session to just share thoughts and concerns and express your point of view. And I get a lot of good input on that and how we address that for the future agenda items for the program. So everyone definitely make sure you plan on staying in those meetings if you can.
Thank you, Kurt. David Boland, I see your hand up, sir.
So I use closed captioning, and it doesn't automatically get emailed to you. Actually, when you put on closed captioning It says who can see the transcript recording on, and the transcript may be saved and shared with others by participants with relevant permission. But that's based on the settings configured for the meeting. So I don't know that you can actually get a copy of the transcript. I've never gotten one. And I use closed captioning pretty continuously. I've always had to ask for a transcript to be sent out by the moderator of the meetings.
Okay, thank you, David. Just, once again, not to beat a dead horse, but we absolutely have not and will not make any move to record the members only meeting. I'm going to move us forward to expanding CDASS item. I know, Kurt, you've in the past spoken to this. Is this an item that you are covering, or staff? Is there someone else?
Sorry, I'm muting myself. Part of this is part of the presentation is that Chana and Julie presented last month regarding expanding CDASS, whether it be for respite care, whether it be for home improvements. And Robin had a lot of input of how we're trying to do it. And one thing that come up, and I think it was a little frustrating when we had the presentation earlier regarding, I believe it was mission, and we kept being told it was participant directed, which is not the same as CDASS. In the essence of having government assigned contractors that are acceptable as opposed to true self-direction or true consumer direction, is the biggest benefit people need to understand is we have budget authority. We are in charge of that money and how it gets spent. So if we have, say, I think the state of Colorado is a $14,000 one-time or lifetime benefit. It's only for primary residents. We got to get bids that are usually pretty outrageous and compared to what other contractors might be able to do it for. And in addition, the concern is always, of course, you're getting ripped off by a contractor, but it might be as simple as saying you have to provide proof of insurance, licensed, insured, and bonded employees. Maybe they're a member of locally it's in the metro area, it's Tom Martino Referral Network or Team Dave Logan. There's a lot of good advocacy regarding contractors that are proven reliable and have a recourse. So I think that was part of it, is that we wanted to have it consumer directed, but at a much better level than just simply the 3 or 4 categories. If you have enhanced homemakers for an SLS, whether it be transportation services, whether it be home improvement or respite or something like that. So I think there was just a little confusion, and that's really what we're looking for of how to address that. And part of it also, and I know Robin alluded to it several months ago, was regarding even having a support broker, well, basically someone who could be kind of an advocate on your behalf for those people that can't do it themselves. And basically, again, a qualified person who could help advocate that. So that's really kind of the report I really had on the expanding CDASS that we're looking for moving forward on. And I think some of it was addressed, but I think there's a lot of work we need to do yet. Danielle, I see you've got your hand raised.
Yes, I just wanted to respond to your comments, Kurt, because I think you're bringing up some really great points, and I think that this is an opportunity for us to maybe clarify where maybe some of our crossed wires are at. So before this project with Mission came to be, or had started with the department, Robin and I want to say Oliver, and I'm sorry if I'm wrong, might have been someone else, but they had brought up expanding CDASS as a way to expand CDASS in and of itself. And I think part of that was extending it to goods and services, as well as expanding some of the flexibilities and things of that nature. Now, fast forward a couple months, there's this project that came up with Mission, which is a different project and not related to expanding CDASS, which was about CDASS specifically. And the expanding self-direction, while it has a similar name, is really targeted towards looking at what options, if any options, are available for expanding self-direction to other services who historically haven't had any self-direction option. So I just want to provide that clarity that they're two different projects, two different subjects. And so I just want to make sure that that's clear to everybody.
Okay, thank you, Daniel. I see Robin and Nathan. I don't know who had their hand up first. Robin, go ahead. I see you.
Yeah. Oh, Danielle, you just muddied the waters. So our intent was to take the service delivery model of CDASS and apply it to other goods and services. So no, it was using the service. That was the intent of, and the discussion at this meeting. So it's not two different things. It's exactly the same things. And we even talked about, you know, alternative services and respite and housing modification within the discussion of, can we expand the service delivery model to more consumer directed to other services? Nobody was, because that's all CDASS is. CDASS isn't a thing. CDASS is a service delivery model. It's not a service. It's home health delivered by a consumer directed model. Respite delivered by a consumer directed model. And isn't that what you guys have done? And Kurt and I received an email saying that Julie and Chandra were working on this, which is why we backed off. And then we asked to be part of what they were working on, and no one ever got back to us. So there's mass confusion here. I don't understand where the communication fell down, but it certainly fell down somewhere. Because no, I don't, Kurt, tell me if I'm wrong. I don't see it as two different things. It's a service delivery model. It's not a new benefit. It's how benefits are provided.
CDASS is a benefit though, Robin.
No, it's not. It's a service delivery model under home health. You can have your services delivered by an agency, or you can have your services delivered by CDASS. Look at the list of services. You don't see one that says CDASS. It says home health. And then you have an option of agency or CDASS. It is not a benefit in a waiver.
And I got to echo what Robin is saying here. And ironically, when I very first got in this program years ago, at the county level, the county I live in is Adams County, and they basically said, why do you feel you're eligible for such a Cadillac benefit like CDASS is? And I pretty much went ballistic at that time and said, that's not what this is. This is an option of home health. And I won't even get into the horror stories of home health and not showing up on time, or if at all sometimes. So with all due respect, Danny, be a little, maybe it is looked at as a benefit, but it's really one of the options of, as opposed to having a home health agency coming in or IHSS, and our choice is CDASS. And we often bring that up, and in the past, I know, Danny, you're kind of newer to it, but that was made a big a point of certain things where people didn't like how this was being run, that this was an option in the state of Colorado. And we teach it that way, that this is a voluntary option as opposed to other
Kurt, this is John.
benefits.
I'm going to interject here and just say that clearly this needs clarification, and there's obviously discussion that needs to happen, but rather than wind into something at the end of the meeting that may go on or may not, let me just say, I'm going to recommend this go on the agenda next time in one form or another. This is an important conversation. I'm just saying right in this moment, we have one more comment in the queue, and
okay, I think that's fair, John.
Forward at that point.
I think that's fair. I think that's fair, John.
Thank you. Nathan, you have 2 minutes, sir. Thank you.
Yeah, just one question that I think maybe helps bring some summary to that discussion for now. Simple question to go on record, and I think it's a fair question. Is the intention of the method of bringing this other perspective of caring for those needs as opposed to apparently not utilizing a CDASS model, is it to preclude doing so, or is it simply to bring some access where none is perceived currently?
Okay, Nathan, again, that question, I think I'm going to ask if it go into our continuing segment number 2 of this conversation. There are 2 things here. There's confusion and disagreement, sounds like, about whether these are indeed 2 separate projects. Are they overlapping? Is it the same goal? I'm not saying I know the answers to those, but obviously this needs more time with this group. And I think that the department could use to be a bit more prepared to participate in that. There's lots of energy here. I don't want to quash that. I'm saying let's move it into the next meeting where we can address it. Having some background noise, I apologize here. The next 2 bullets on the subcommittee and work group are for October, so we're not doing those now. I will move us into the open forum. Again, a 10-minute period. It's announcements, it's questions to put out to the group, not necessarily to get into a back and forth, but questions you might want to put to the group, networking within this community, those sorts of things. Does anyone have an item for the open forum? If you can raise your hand in the webinar, or if you're on the phone, to unmute by pressing *6 and give me your name. Anyone for the open forum? Okay, hearing none, seeing none. One more time. In case anyone's having trouble with the raise hand function, you go down at the bottom, raise hand, or if you have a small screen like me, it says more, click reactions, and then click raise hand. Okay. I'm hearing none, seeing none for today. Folks, we are up for our next meeting in October on the 4th Wednesday, scheduled for up to 4 p.m., 1 to 4 p.m. We've been ending a bit earlier than 4 in recent meetings. I want to thank everyone for your participation today. Again, this meeting the general meeting was recorded, and I will endeavor to get that link out to people to listen to as soon as I can. I will commit to next week, and it's often been happening quicker. And with that, I will close the meeting and thank you everyone for your participation today.